Any New Yorker with health insurance can access Narcan, known generically as naloxone, at over 2,000 participating pharmacies statewide without a prescription through the state's NCAP, Naloxone Copayment Assistance Program. Insurance covers the cost of the medicine, and the state covers the cost of any copay of up to $40. In order to be able to effectively administer this life-saving opioid overdose reversal drug, pay close attention to the following Narcan training video. Hi, my name is Kevin Donovan. I work for ACR Health, and today we're going to train you on how to administer Narcan. Some key takeaways I'd like you to take away from this training would be that, 1, Narcan is effective on any opioid overdose, including fentanyl. 2, Narcan will not harm somebody if given by accident, so if you're unsure, you give it. 3 would be that Narcan is safe for children and pregnant women. 4 would be that a determining factor to tell if somebody's overdosing. Is that person responsive or are they unresponsive? And 5, you are protected under New York State's public health law to be able to administer Narcan to anyone whom you believe is having an opioid overdose. So, what are opioids? Opioids are heroin, methadone, morphine, oxycontin, oxycodone, Percocet, Percodan, Vicodin, hydrocodone, hydromorphone, Dilaudid, basically all your prescription pain relievers, codeine, tramadol, and fentanyl. Fentanyl is the one outlier with opioids. When someone's overdosing on fentanyl, it's usually momentarily after they ingest it. Every other class of opioids that I just mentioned, it's a process that takes place usually over 1 to 3 hours. So, basically, a person can overdose on opioids, on any opioids, no matter how they ingest them, whether they're taking pills orally, whether they're injecting them, whether they're sniffing or smoking them. So today we're going to go over who's at risk for an opiate overdose, and the signs of an overdose, how do you recognize it when you see it, and then how do you administer Narcan to potentially save someone in case you encounter somebody who's overdosing. So the main risk factors for an opiate overdose would be lower tolerance. A lower tolerance happens when someone who's dependent on opioids or uses opioids a lot stops using for a period of time, whether they go to rehab or jail or they stop using on their own, even if it's just 36 hours. Their tolerance is then diminished, and if they go back to use again, that first use is oftentimes a fatal overdose. Their body cannot handle the amount of drugs that they were using before. Another major risk factor would be mixing drugs. Now, this doesn't have to be street drugs. This can be co-prescribed drugs from the same doctor. It could be street drugs like heroin or cocaine, but it could also be like medications like Xanax mixed with hydrocodone. So it could be someone who has an injury and they're out at the bar and they're mixing it with alcohol. So opioid overdoses happen from opioid-induced respiratory depression. It means a person stops breathing. So if you're mixing any opioids with something that's a sedative or a depressant and they're causing a person's breathing to slow or their central nervous system to slow down, that person is at an extreme risk to an overdose. Another risk factor would be if somebody's seriously ill and using opioids. It could be something serious like HIV, hepatitis C, heart disease, or lung disease, but it could be something as minor as the flu virus. If their immune system is compromised while fighting off the illness, they're at extreme risk for an overdose if they're using opioids at that time. Another risk factor would be unknown product or a variation in potency. So what this would mean is if people are buying drugs off of the street, they never know what they're going to get. And nowadays, fentanyl is really being cut into a lot of different things, including cocaine, including methamphetamines, including Molly. There's even pills out there that are designed to look like oxycodone pills. They look the same color, shape, and stamp, but they're straight fentanyl pills, and a person could take one by mouth, and it could be a fatal overdose. So buying drugs on the street is risky because you never know what you're going to get. And the last risk factor I want to talk about is using alone. And this goes back to shame and guilt. A lot of people will use alone out of shame and guilt. They'll hide their use from people, and they won't tell people that they're using. So there's nobody there to actually check on them to see if they're overdosing. Sounds like common sense, but it happens all the time. So those are the main risk factors. How do you recognize an overdose when you see it? As I said before, except for fentanyl, this happens on a 1 to 3 hour process. So it takes place over time. So there's a lot of time to intervene. It's like a spectrum. At one end of the spectrum, you would basically have death. So if you ever encountered somebody and they looked dead, they had no vitals, they were blue, stiff, cold, don't assume that it's too late, all right? At the other end of the spectrum, when an overdose could just be starting, it could start with what's just called a heavy nod or an opiate nod out. So people who use opioids regularly, they'll get into a state which looks like a nod out state, which looks like they're falling in and out of consciousness, almost falling asleep and waking back up. If you see somebody like that, what your job is to do is to try to get a response out of that person by stimulating them any way you can. Shout their name, shake them. We train to do what's called a sternal rub, where you make a fist with your hand and you rub it really hard in between the chest cavity on their sternum. It's supposed to cause a moderate amount of pain, which should wake a person who's not overdosing. So if a person's not responding to that, that's how you know that they're overdosing. If the person's nodding and you shout to them and they respond, they say, "Hi, I'm okay, I'll be all right," they are okay for then. But it's important to keep an eye on that person because it can progress, as I said, over the next couple of hours. If it is progressing into a serious overdose, you would see signs like slow breathing, shallow breathing, or breathing will stop altogether. You'll see a change in skin tone from a palish color to a bluish color. Dark-skinned people will be an ashen color. Lips and fingernail beds will turn blue from a lack of oxygen. You could hear an unusual gurgling or snoring sound coming from the respiratory system. You also might want to check their pupils. Their pupils will be pinpointed, very small pupils, if the person's overdosing on opioids. This might not be the case if the person's mixing drugs, so don't let that be the determining factor of whether you think it's an overdose or not. The determining factor is whether this person is responsive or whether they're unresponsive to your stimulation. And just remember, if you're wrong, you're not going to hurt the person. So if you're unsure, you're going to give it no matter what. So say you encounter somebody and you believe that they're overdosing. First of all, if you encounter that situation, you got to be aware of the scene. Survey the scene. There could be an exposed syringe somewhere laying around the scene. What do you do if you approach somebody and they're overdosing and they have a syringe hanging out of their arm? Well, we would suggest that you take that syringe, you pull it out, and you isolate it somewhere in the distance to where it's not going to poke somebody. But that's going to be your judgment on whether you want to take action. We would not suggest trying to administer Narcan to somebody with the syringe still sticking out of their arm, because it could poke out and it could pop out and poke you at some time during the process. So once you're aware of that scene and you think that person's overdosing, you're going to try to get that response out of them. If they're totally unresponsive, then you know you have to take action. So it is a little bit subjective at this point. You have to tell, has their breathing stopped altogether, or are they breathing still and unresponsive? If the breathing has stopped altogether, it's going to be important to get Narcan in them first. So how do you do that? Well, we give out at ACR Health, right now we're giving out nasal Narcan. It's a name brand Narcan. Some people call it naloxone. That's like Kleenex and tissue. Narcan is the name brand, naloxone is the medicine. So usually we give out these overdose rescue kits. In each kit, there's going to be 2 doses of nasal Narcan. So once you've made that decision in your mind that this is an overdose, step 1 is going to be call 911 unless the person's not breathing. Then step 1 is going to be give the dose. So when you're ready to give that person this dose, you would have 2 of these doses in your kit. You also have gloves and a rescue breathing shield, alcohol wipes, and a booklet for instructions in case you forget any of this. So when you're ready to administer this dose, what you want to do is peel it out of the package. If the person's not already lying on their back, lay them down on their back. You get this Narcan out of the package and it looks like that and it's ready to go. It is very easy to use. You put your 2 fingers on the top, you put your thumb on the bottom. The medicine is in this plunger and it's a very concentrated dose. So you want to make sure that you don't push on that plunger until this part is inserted all the way into the person's nostril. So you're just going to insert it into one nostril all the way until either finger touches the bottom of their nose. And then you just do 1 push, and that's the entire dose. You can throw it away after that. So after you've given that 1 dose, it's important to check the person's breathing. It takes Narcan about 2 to 5 minutes to start working. So if you've given that dose and you haven't called 911 yet, then's a good time to call it. It's also how you can check the person's breathing and perform some rescue breathing. Every kit that we give out has a rescue breathing shield. Comes in the kit like this. You just rip it open and peel it out. This rescue breathing shield is pretty simple, and it shows you right on there where to place it over the person's face and how to use it. Now, rescue breathing, anybody can do. You don't need to be CPR trained. So if you already have the person on their back, you want to place it right over their face, and it shows you right on there. You pinch their nose closed, make sure their head is tilted back and nothing is lodged in their throat that they could be choking on, and that goes under their chin, and you're going to breathe right through this white pad to give the person oxygen. This can help the person wake up from an overdose faster, and it can also prevent the person from being brain dead if they come out of it a couple minutes down the way and they haven't been breathing. So in order to do rescue breathing, you just start with 2 breaths really hard back to back into the person's mouth. You should be able to see their chest rise when you're doing this. That's how you know you're doing it properly. So you would just go like this. And then you keep counting to 5 and do 1 breath at every 5-second intervals. If you get to what you think is 2 minutes while you're doing rescue breathing, or even if you didn't have to do the rescue breathing, if you get to 2 minutes and the person isn't waking up, then you're going to get the Narcan and you're going to repeat the dose. You give the second dose of nasal Narcan, same way, you pull it out of the package, but you do it in the opposite nostril. And then if you need to continue rescue breathing, you go ahead and continue to do that rescue breathing. When a person wakes up out of an overdose, be prepared that there could be a lot of different reactions. Usually the first reaction is going to be confusion and shock. What's going on? Why are there so many people around? But it could very quickly turn into a lot of different things, including aggression or projectile vomiting or hysterical crying. So to be prepared to try to keep that person calm and explain to that person that they're still at risk for an overdose because Narcan only lasts for 30 to 90 minutes. It's a temporary acting drug, and the person can go back into an overdose even if they don't use again, but especially if they use again. So you want to make sure that that person doesn't use again, and you would hopefully talk that person into going with the ambulance to be monitored furtherly. If the person refuses to go with the ambulance, make sure that you or somebody else is willing to stay with that person and keep an eye on them for at least 3 to 4 hours. Hopefully by the time you would need to give a second dose, you have paramedics arriving, at which point you could just tell the paramedics, I gave the person this much Narcan, and you can let them take over. We would also ask if you use a kit to reverse an overdose, that you would call ACR Health and report that overdose to us so we can get a better understanding of how many people are actually being saved from Narcan. These are statistics that often go extremely underreported. So we could also give you a replacement kit at that time, or access to a replacement kit. So that's basically the essence of the Narcan training. Narcan is effective on all opioid overdoses, including fentanyl. Also, Narcan will not harm someone if given by accident. So if you're unsure, give it. Narcan is safe for children and pregnant women. The determining factor to tell if somebody is overdosing is that person responsive or unresponsive? You are protected by law to be able to carry and administer Narcan. Also, keep in mind that all Narcan expires and should be stored at room temperature away from direct sunlight. So this is the name brand Narcan that we give out at ACR Health, but if you go to the pharmacy to access Narcan through the NCAP program, you might end up with one of these other 2 formulations, the nasal injection Narcan or the intramuscular injection Narcan. Thank you for taking the time today to watch this video and learning how to save a life.